Morning guys, I want to speak this morning a little bit about pain because often when a person comes in for treatment from a healthcare professional, one of the primary reasons is that they're in pain. So the question is, what is it they're actually experiencing and how can we understand that a little bit? So, if I take this pen and I touch my skin, all that's happening is I'm deforming sensors within the skin itself. That generates an electrical impulse, and that impulse goes up the sensory nerve to the brain. So it's a little bit like me flicking a light switch and sending an electrical impulse through a wire to the bulb. Now, when that happens, the electrical impulse gets into the brain, and when it gets into the brain, I am going to interpret that impulse. So rather than thinking that I'm feeling a sensation somewhere, I know that I'm feeling a sensation in my hand, even if I close my eyes, because the representation of the body in the brain is quite accurate. So if you like, I have the representation, a picture of my hand in the brain, and so I can recognize that I'm feeling something. All right, so far so good. If I take this pen and I touch it a little bit harder, a little bit harder, and a little bit harder still, I'm increasing the stimulus on the receptor within the skin. But of course there gets a point where I could cause skin damage, and at that point that's a threat to my body, and so I need to react. So what's happening in the brain is that the electrical signals are building up, and when they hit a threshold point, I'm changing that feeling of pressure and interpreting it as pain. So we're changing from the feeling of touch, which we officially call nociception, to an interpretation of that signal as being painful. So I'm feeling pain, but I'm feeling pain not so much through my reaction in the skin as my interpretation of that reaction in the brain. So I experience that sensation and I have this representation of the hand in the brain. But how do I make that judgment call that the first stimulus was simply touch, but the second stronger stimulus is now pain? Well, it depends on my interpretation of what threatens my body. And so what I will do is I will draw on other bits of information to make that decision. So I'll draw on past experience and I'll say, well, have I had this sensation before? And if I have had that sensation before, what was the result? Did it injure me? And if it did, then my interpretation of what I'm feeling would be that that is a threat, and so that is therefore pain. But I could also draw on other information. How do other people react to that? So for all of my friends at school felt that sensation when I was 14 and they all reacted by saying, oh, that's really painful, it's more likely that my interpretation of that signal is that it would be painful. My belief systems would affect this. How things are described in the newspapers. Oh my goodness me, is it a bite from something which is going to infect me? I read about that in the newspapers. So all of these sources of information come together to help my interpretation of pain. And we call all those various different signals coming from different areas of the brain the Neuro Matrix. So far we've got several things. So we've got a sensor in my skin. We've got an electrical impulse going up through a nerve, so an electrical wire, if you like, to a computer, which is my brain. That signal is recognized and then interpreted by other parts of the brain to tell me whether that should be painful. So the question then is, well, can we modify these signals in any way? Well, let's just have a look at this. So firstly, we can modify it at the level of the skin. So you might say, well, you know, if I'm wearing a glove, then that sensation of tapping with the pain is going to be lessened because I've modified the skin. As we have our electrical impulses going up, if we take that analogy of the light switch, can I modify that electrical impulse? Well, I can. If I stuff a screwdriver into the electrical cable, something's going to shorten out. So if it shorts out, I've modified that electric stimulus. Okay, so if we take that example still further, we say, well, if I flick my light switch, then an electrical signal runs along the cable, lights up the light bulb. But I could extend that cable all the way from where I am in Cheshire, all the way into New York. And it could go under the sea in a very long cable. But of course, by the time that signal gets to the light bulb in New York, it's going to be pretty faint if it's going to arrive at all. So what I do in electricity terms is I have an electricity substation. So my first signal goes all the way to the coast where there's an electricity substation. That then takes the signal and it boosts it, sends it under the sea to New York where there's another electricity substation, takes the electrical signal, boosts it and sends it on. So I can take that signal and I can increase it. But of course I could also, in that electrical substation, have somebody who's going to switch the switch off. So they say, well, you've got that signal, you can make that signal as strong as you like, but I'm not going to let it go. I'm not going to let it go into the next wire which goes under the sea. So we have a similar system in the body, in that when I touch my skin, I get that electrical signal going up towards the brain, but it doesn't go in a continuous pathway. When it gets to the spinal cord, it stops. The signal is then passed on to another nerve through a little gap, a little junction called a synapse, and that other nerve takes the signal and it can modify it. So it can boost the signal and increase it, or it can calm the signal down. So an example of calming the signal down would be to say, well, if I gently touch my skin, I can feel it because the signal is getting through to the brain. But if I come along and I slap my skin hard, that second signal is stronger than the first, and so it blocks the first signal out. I therefore don't feel the sensation of the first signal. We call that a counter-irritant effect. And that is one of the ways that a hot massage cream works, or a hot rub. It has a counter-irritant effect. It stimulates the nerve more strongly, or it stimulates more sensors affecting into that nerve, and so it blocks the first signal. All right, so this is important because it gives us ways that we can calm pain down, but it also, importantly, gives us ways where the pain could be made stronger. So if we take a signal and we tap the skin, it sends an electrical impulse up to that area in the spinal cord, which we call the dorsal horn. In that area, I've got one nerve stopping and another nerve starting. So that junction, the signal generated, it passes over the junction through the release of a neurochemical. And that neurochemical can be exhausted. And if it gets exhausted, then the signal will be lessened. But equally, what I can do is I can deliberately boost that second signal and make it far stronger. So we can increase and we can reduce signals at the level of the spinal cord. Now, when my electrical signal goes up further, it goes to the brain stem, where one nerve stops and another starts. And again, we can change those signals, but we have a system in the brain stem whereby we can flood the body with chemicals which will lessen your reaction to the signal. And we call that, it's got a complex name, it's called diffuse noxious inhibitory control. So diffuse meaning everywhere, noxious meaning, well, something which is a nasty signal, and we're inhibiting it, so we're trying to calm it down. And it's one of the methods that we have of naturally reducing our pain response. And the final thing that can happen is in the brain, where I said we're interpreting all these signals, that interpretation could be increasing or reducing the signal. So how is this all important to us as healthcare professionals, and how is it important to the patient? Well, many people believe that if I touch the skin and it causes pain, if I get more pain, it means there's more damage. But obviously, from what I've said so far, that is not the case. You could be getting more pain simply because your interpretation of the signal is greater, or more pain simply because of the way that that signal is crossing over the junction in the spinal cord. So an example of this would be a mosquito bite. I touch my skin, it doesn't really hurt, I can just feel it. But if I get a mosquito bite, the whole area gets red and inflamed. Now I touch the skin, oh, that's really painful. So the same signal is giving a greater amount of pain, and we call that hypersensitivity. So rather than the signal going through slowly, it's gone bonkers, hypersensitivity. The other thing that can happen is something officially called allodynia, where we have a signal which normally wouldn't be interpreted as being painful, but now it is. So how would that occur? Well, let's imagine somebody's got knee pain, and every time they're walking, it really, really hurts and it's really swollen. Over a period of time, that can become a little bit of a habit, and as they start to improve, they're starting to do exercises, but because they're fearful that their knee pain may come back, or they're fearful that they might suddenly get that bolt of pain that they once had, now they start to interpret signals which were previously normal as being painful. And one of the ways that we can manage that is to reset the signal through doing repeated movements. And that repeated movement constantly says to the body, look, I'm feeling a strong sensation, but that sensation's okay. So you don't need to interpret it as pain. Okay, so take-home message from this little bit then is that what you feel in terms of discomfort and pain doesn't necessarily reflect the amount of damage in your body. So you can have a small amount of damage and an awful lot of discomfort, or you can have a lot of damage and a very little amount of discomfort. And we've probably all had that situation where somebody says to you, what have you done to your knee? You've got a big bruise on it, and you can't even remember hitting your knee because you didn't feel that pain at the time. Okay, so thanks very much for looking. We'll have another video on a slightly different aspect of pain later. If you enjoyed this, please give us a like on our YouTube channel, subscribe to it, and then you'll get to know about future videos. All right, thanks so much for watching.